Hi, and welcome back to this free-for-all Friday edition, Focal Point AFR Talk. Number to call, 888-589-8840, 888-589-8840. Talk about anything that's been in the news or been on this program over the course of the past week. I want to talk about the VA situation just for a minute. You know, everybody realizes that this thing is a complete disaster. It's a complete debacle. People are dying. We've had maybe 100 deaths now in VA hospitals attributed to neglect, to delayed access to care. We know now that the VA hospital is jiggering the numbers. They are just lying on their statistical reports to make it look like they're seeing these veterans sooner than they are. They're not even entering the data into computers. They're keeping these appointment records and so forth on paper so they can shred them, so there's just no trace whatsoever that this vet and vets that die because they have been, their access to services have been delayed, they just delete them like they never existed, so they don't even show up as a statistic on their information sheets. So we all know this now, that this is a complete and utter, absolute debacle, disastrous failure of socialized medicine. But I want you to just read some quotes from some liberals who thought that the VA system, because it was government-run, because it was single-payer, that this was nirvana. I mean, these people actually believe this. Here's Paul Krugman. He's a Nobel Prize winner. And he says this, in 2011, the VA is a huge success story. Yes, this is socialized medicine, but it works. And it suggests that what it will take to solve the troubles of the U.S. healthcare more broadly. In other words, he's saying what we're doing in the VA, single payer, government run, we ought to do that for the entire country because the VA is working. Now, this writer, Ben Shapiro, points this out, that there are 8.76 million veterans using the Veterans Health Administration. So they got about 9 million patients or clients. Now there are 314 million Americans. And he does a prorated thing. He says if you take the 40 deaths of veterans already confirmed, this is the ones we know about, the number is much more likely to be closer to 100. If you take the deaths already confirmed at the Phoenix VA and you prorate those numbers across the entire American population, that would mean if Americans were getting the same kind of care, listen to this. If Americans across the board were getting the same kind of care in their hospitals that veterans are getting in the VA, we would have 1,500 Americans dying every year just because they are waiting in line. Again, you prorate out the rate of death in this one hospital. That's just in the Phoenix hospital. You prorate out the rate of death in that one hospital. That would be 1,500 Americans every year that would die because access to health care was delayed. They were kept waiting in line. Ladies and gentlemen, that is a death panel on steroids. That's just a low estimate. There's 1,700 hospitals, and that 1,500 figure, prorated, is based on one hospital in Phoenix, Arizona. And by the way, the director of that hospital in Phoenix, where those 40 guys died, got an $8,500 bonus last year. I mean, this is the difference between conservatism and liberalism. Conservatives reward success. Conservatives reward accomplishment. Conservatives reward achievement. Liberals reward failure. Liberalism rewards ineptitude. Liberalism rewards incompetence. For instance, in Michigan, the state legislature is going to give $200 million to the city of Detroit. Why? Because they have run that city into the ground. They've run it into bankruptcy. And how do liberals respond? Let's throw more money. Let's reward them for their ineptitude and incompetence by throwing them $200 million. So anyway, Paul Krugman, VA healthcare, this is better. This is the greatest thing since mayonnaise. Nicholas Kristof, he's a Pulitzer Prize winner. He said this, take the hospital system run by the Department of Veterans Affairs. It is fully government run, much more socialized medicine than Canadian healthcare. And the system for veterans is, by all accounts, one of the best performing and most cost-effective elements in the American medical establishment. You know, and I could read, I've got more quotes here everybody talking back in the day about the wonders of socialized medicine as exemplified by the Veterans Administration. Now, here's something that'll just give you a heart bleed. This is from J.D. Gordon, who was a spokesman for the Bush administration, been to Guantanamo Bay, he says something like 30 times. He was a spokesman for the Pentagon from 2005 to 2009. And he says, look, and this will make your blood boil. I guarantee it. It'll make your blood boil. It made my blood boil. The Al-Qaeda terrorists at Guantanamo Bay are getting better medical care, better health care than our veterans. I mean, I'm feeling it right now. The Muslims who are in prison at Guantanamo Bay because they tried to kill us are getting better health care than the veterans who risk their lives to save us and to protect us from the people that want to kill us. And this is not an exaggeration. And J.D. Gordon is writing from what he has seen as a spokesman for the Pentagon. Listen to this. Despite the fact that Al-Qaeda terrorists carried out the September 11 terror attacks, killing 3,000 people in America, the admitted co-conspirators and the roughly 150 fellow jihadists at Gitmo have approximately 100 doctors, nurses, and healthcare personnel assigned to them. Doctors and medical personnel are at their beck and call. Got a cold, a fever, a toothache, a tumor, chest or back pain, mental health issues, PTSD, no problem. Come right on in. Military doctors are waiting to see you. So these vets at the Phoenix VA, up to 26 hospitals are looking at now, they are dying because they cannot even get in to see a doctor. But at Gitmo, you've got doctors waiting hand and foot on these patients. They get a sniffle, they've got a doctor, they've got a nurse on the spot. And you look at the ratio of patients to medical personnel. In Gitmo, it's 1.5 to 1. You got 150 inmates, and you have 100 medical personnel dedicated to serve them. That's a ratio of 1.5 to 1 to provide medical care for the Muslims who are dedicated to killing us in the name of their God. The ratio for America's veterans is 35 to 1. You have 35 veterans needing medical care for every single member of the medical profession that's dedicated to give them some help. 9 million American veterans in the VA system, 268,000 employees. That's a ratio of 35 to 1. So, ladies and gentlemen, this thing, I mean, it is unexcusable. I mean, no matter how you slice it. And the problem is not funding. VA spending is up 92% in the last decade. So it's not like they've been underfunded or have been neglected. Their spending is almost double today. That's in inflation-adjusted dollars, almost double today to what it was just 10 years ago. Let me save those sound bites for after the break. Let's get to a couple of phone calls. Let's go to Jim in Dallas, Texas. Jim, welcome. Thanks for calling. Thanks for waiting. What's on your mind?
Hey, Brian. First, thanks for contrasting the ratio of doctors to prisoners versus doctors to veterans that are suffering under Obama VA care. That's an important fact you brought to light there, and I hope you'll continue to point that out to people. But I wanted to challenge you on two issues. One is on your comments about the supposed reversion of the head of the Southern Baptist Convention, and the second was on a biblical comment you made earlier in the week. Which one would you like me to go with first?
Take your pick.
Okay, on the Bible, you said earlier in the week that the reason that the descendants of Jacob had to wait 400 years in Egypt was because it took that long for God to find a man that would do his will, being Moses. Did I state your view correctly?
That's correct.
Well, that can't possibly be true, Brian. The reason they had to wait 400 years is because that's what had been prophesied long before. It didn't matter how many men of God had popped up in the meantime. They were going to be down there for 400 years.
Well, I guess the question then would be, are you assuming then that God did not know how long it was going to take for him to find the guy?
I'm saying he knew exactly how long they were going to be down there because that's what he prophesied. And no man of God popping up earlier than that was going to cause them to get out of that 400 years. Scripture was not going to be changed because someone popped up that did God's will.
Well, or Jim, it's possible because of God's foreknowledge. Because of God's foreknowledge, he knew how long it was going to take before the right man arrived on the scene, and he revealed that information to his prophets, who said, look, it's going to be 430 years.
Well, you can paint it that way if you want, but your comment made it like he was just open-ended, waiting for the first guy to stand up to do his will, and then it was going to get them out of there, and that's not the case.
Well, let me ask you this, Jim, to respond to Exodus 22:30 then. This is a very familiar verse. This is God speaking. I sought for a man among them who should build up the wall and stand in the breach before me for the land, that I should not destroy it, but I found none. Therefore, I have poured out my indignation upon them. So in other words, God is looking for a man. He's searching for a man. He's looking high and low. He doesn't want to destroy the land. He wants to protect them from his wrath. So he searches the entire land for just one man who would be willing to stand in the gap and be the instrument through which he could work to protect that nation, that people, from his wrath. And he couldn't find a single one. Therefore, indignation and wrath and destruction came to that city. Can you hang on, Jim, over the break?
Sure.
I'd like to get to your second question. I got about 30 seconds. Do you have any reaction to the Ezekiel 22:30? I searched for a man and didn't find one.
Don't have a problem with the fact he knew Moses was coming along. I just had a problem with the suggestion that if someone else had come along sooner, they would have gotten out of there sooner than 400 years.
Well, but I guess my response to that, and again, we'll have to wait until we can ask God to find out. My response to that would be God knew that nobody was going to pop up for 430 years, so he could reveal that information to his prophets without fear that somebody was going to pop up and throw off the prophetic word he'd given. All right, Jim, hang on. We'll get to your second question coming out of the break. Focal Point, AFR Talk.